This is exactly how I got pregnant, not once but twice, naturally with PCOS, when my doctor said I might have to go on a fertility treatment. And I'm going to share my 7-step framework to conceive with PCOS without any fertility treatments or medication, but all naturally. This is exactly how I did for myself and conceived 2 beautiful daughters who are mashallah 3 and almost 1. This is Hina, a fertility doula, or you can call a fertility expert and a childbirth educator. So the very first step of this framework is getting a thorough blood work. Deep diving into your hormonal profile is very, very important before you start planning to get pregnant with PCOS, because you want to avoid the disappointment. And unfortunately, most doctors do not do a comprehensive blood test when it comes to PCOS. They just do the basic CBP and some, LH, FSH and all that stuff, and maybe thyroid in some cases. But there are other important blood markers that have to be counted, such as, fasting blood insulin, the testosterone, androgens, fasting glucose, and all that stuff. Fasting insulin is one of that most important blood marker that has to be evaluated before you get pregnant. If you know it or not, more than 80% of PCOS or PCOD women suffer with insulin resistance. Now, it could be mild, it could be, a major form of insulin resistance, it could be on any level. And this can actually be a big hindrance in conceiving. And it's also important that you have to get checked for your prolactin levels, because prolactin levels can also cause disturbance in terms of your cycle or conceiving. A study published in the Journal of Clinical Endocrinology and Metabolism actually highlighted the importance of evaluating all these parameters in order to manage the PCOS more effectively. You can still conceive with PCOS, but you just need to keep some blood markers within, limits or like perfect levels, so that you don't have any obstacles during this entire process. Step 2 is right supplementation. Modern science supports the use of specific supplements in case of PCOS women. Myo-inositol, for example, is very well known to improve the egg quality and also curb the insulin resistance. You can consider this as an alternative to metformin, which usually comes with a little bit of side effects. A study from European Medical and Pharmacological Sciences have actually highlighted the importance of myo-inositol. I have personally taken myo-inositol when I tried to conceive both the times, and it has done nothing but wonders. And did you know I conceived actually in the very first month both the times? And because I'm already in this field and profession, I knew how to track my ovulation, and when to do the deed and all that stuff. So I was able to successfully conceive twice. And another supplementation that's crucial for PCOS women is omega-3 fatty acids. So if you're not someone who eats a lot of fish, especially fatty fish, then please opt for an omega-3 capsule. Omega-3 capsule has these anti-inflammatory properties that have been linked to improve the menstrual cycle and the ovulation. There are plenty of supplementations in the market for PCOS. There are different brands, but unfortunately, some are really fake and they don't do the job. You really need to have a customized supplementation based on the step 1, that is a thorough blood work, so that you are using what is just needed for your body. What supplement might suit me may not suit you. That's also one important factor to consider. And what supplements are required for my type of PCOS may be exactly opposite to your type of PCOS. So please work with a qualified professional when you want to use the right kind of supplementation. And once you have implemented the step 1 and step 2, the step 3 is nutritional and lifestyle changes. This is the most important step in my entire framework, because this is where the results lie. Dietary interventions play a key role in the PCOS and PCOD. There are different kind of diets, that are marketed by the professionals, that, keto is good, low carb is good, high protein is good. So the thing is, all these diets actually work, but again, it depends on the individual itself, what is right for their body type and for their symptoms. But in general, what you can do is emphasize on a low processed food diet, where you avoid any kind of junk processed foods like sugar, marketed goods like, that you get on the shelf. Try to avoid anything. And also the best tip I would like to give is, if you are reading a label, avoid any kind of food product that has more than 10 ingredients and that has any ingredient that is very difficult for you to pronounce. Include foods that are rich in fiber. High fiber can actually help improve your insulin resistance. and include lots of protein. The amount of protein can vary anywhere between 0.8 to 1 grams of protein. Try to aim for a higher protein. That way you will be able to have a balanced blood sugar throughout the day. Start your day with a good, healthy protein and fatty meal. And the research from International Journal of Endocrinology has promoted the outcome of these dietary lifestyle changes in PCOS women has led to improved ovulation, improved menstrual cycle, and also improved insulin resistance. Step number 4 is sleep management. We all know the link between the sleep and the hormonal balance is very well established. Poor sleep quality and duration can actually worsen your insulin resistance, and I have been guilty of this because I have done this plenty of times when I was not really focusing on my sleep. When you have a worse insulin resistance, you often feel this hunger pangs, you want to eat a lot during the day and night, you end up eating all the junk in the bed, which actually further kind of ruins your entire sleep. All these bad habits can actually disrupt your reproductive hormonal axis. There's also a publication in Fertility and Sterility which has actually discussed poor sleep habits can actually ruin the fertility. This is not just for women but also for the men. What you can do in order to improve your sleep productivity is cutting down on your gadgets at least by 1 to 2 hours every single night, so that you are not exposed to any kind of cell phone or laptops. Try not to use any gadgets 1 to 2 hours before the night, and always target to sleep for at least 6 to 8 hours. 8 hours is ideal, but I know we all are busy working, we might already have kids, which can be very stressful. So I think focus more on the quality of the sleep than the quantity of the sleep. So 6 to 8 hours of uninterrupted sleep can do wonders to your PCOS. And number five is the weight management. If you might have noticed, most of the PCOS women are usually obese or overweight. But there are also women who are not overweight, who are extremely lean, and this is called as lean type of PCOS or lean PCOS. It's very, very important that you at least lose 5% of your current existing weight, so that it will significantly improve your menstrual cycle, your ovulation, and also your insulin resistance. Whatever you're doing in the step 3, which is called as the nutritional lifestyle changes, right? They really help a lot to reduce the weight. You can do, exercise, or you might try different kind of intermittent fasting windows and stuff in order to lose that 5% of the weight. I will talk more about this in the future videos, but for now, just let's stick to this. Number 6 in the step is regular exercise. It's very, very important that you do some sort of physical exercise in every single day. It's at least for 4 to 5 times a week. It need not be a high intensity interval training. It can be low intensity interval training as well. Again, there are different opinions across the internet that HIIT is very bad for PCOS or for hormonal problems in general. Well, this kind of holds true because it can disrupt your cortisol hormone. So don't try to rely more on HIIT workouts every single day, but try to focus on at least 1 or 2 sessions every single every week. You can focus on a combination of both aerobic and strength training, but make sure your strength training workouts are at least 80% of your entire workouts during the week, because the heavier you lift, it's the better for your muscle, which means it's better for your insulin resistance. A systematic review in sports medicine have actually showed benefits of exercise in improving the fertility outcomes in women who are struggling to conceive with PCOS. You can also normalize the hormonal imbalances by performing regular exercise. Number 7 in this step, which is also another crucial step to conceive, that is tracking your ovulation. Unfortunately, most women are not really very well aware on how to track ovulation. They think it just happens on day 14 of the cycle, but it's far from true. Very less percentage of women actually have this 14th day ovulation thing in the body, because they have usually 28 or 29 days of cycle. But with PCOS women, your cycles can be all over the place, and you might not have had period in months, and it's very difficult to track ovulation based on a calendar or based on an app. Time your intercourse based on your ovulation so you can improve the odds. That's what I have done both the times, and I exactly knew when I was ovulating, and had tried to make the most use of it. Now, what you can exactly do when you have PCOS is probably you can use your body signs, such as, looking at your cervical mucus, looking any kind of, sharp pain or pain in the breasts, underarms. You can also use ovulation predicting kits, which are OPKs that you can find on Amazon as such, and then you can start tracking. So please try to track for a prolonged duration, such as 15 to 20 days in a month. That way you can know, if you're ovulating or not, if there is an increase or a surge in LH hormone. So this can be a little tricky for the first timers, for the beginners, but I will definitely post a video on that. If you are already coming back to me from my old videos, you might not see those videos now, but I've explained in detail about ovulation and stuff. So I will try to post that once again. My number one tip would be track ovulation and time your intercourse, and the odds will increase significantly. And last one thing I want to say is medical interventions. If you're really struggling to conceive even after adopting a healthy lifestyle habits, nutritional changes, tracking ovulation for 3 to 6 months, then it's time to look into the medical interventions and use medications such as letrozole, Clomid, sometimes even metformin to improve your insulin resistance, and then you can go from there. Most women are successfully able to conceive with just letrozole and Clomid, but some are not able to. Now, this could be because of many other underlying issues that are, happening in the women's body. So you can also opt for reproductive technologies such as IVF, IUI, and all that. But again, for any kind of treatment to be successful, you need to make sure that egg quality is really high. So it's very, very important that you still nourish your body in a way that can support all these processes, and you have a successful outcome when you're doing IVF or IUI, because these treatments are very expensive wherever you live, especially in the North America. So you don't want your money to go waste. So that said, these are my 7 steps in my framework, and I totally understand that navigating PCOS and PCOD can be very, very overwhelming, but remember, you're not alone. With right approach, support, and guidance, you can definitely conceive in the very first time or in the very first few cycles itself. And if you're seeking a personal guidance for PCOS and struggling to conceive, you can definitely reach out to me. There is a form in the description where you can fill the form and schedule a 20-minute free consultation call with me, and I can help you plan your pregnancy. So for more insights and support, please subscribe to my channel, Mama Munchkin and More, and I'll be seeing you in another video. Till then, take care, and yeah, please do like the video as well. Bye-bye. Allah Hafiz.